labetalol, metoprolol, pindolol, propranolol, and so on. Beta-adrenoceptor blocking agents are currently recommended as first-line drug therapy for hypertension when concomitant disease is present, for example, heart failure. These drugs are efficacious but have some contraindications. The action of beta blockers is to reduce blood pressure primarily by decreasing cardiac output. They may also decrease sympathetic outflow from the central nervous system and inhibit the release of renin from the kidneys, thus decreasing the formation of angiotensin II and the secretion of aldosterone. The prototype beta blocker is propranolol, which acts at the both beta-1 and beta-2 receptors. Selective blockers of beta-1 receptors such as metoprolol and atenolol are among the most commonly prescribed beta blockers. This diagram shows the action of beta-adrenoceptor blockers. As you see, there is decrease in the activation of beta-1 of the heart, and this will lead to decreased cardiac output and decreased blood pressure. On the other hand, it will decrease the release of renin, and this will lead to decreased angiotensin II, aldosterone, sodium water retention, and blood volume, and this will lead to decreased peripheral resistance, so that مثل ما تشوفون يعني البيتا بلوكر it will act on the both factors or variables of the equation, يعني cardiac output with peripheral resistance اثنيناتهم راح يقلن with the use of beta block. Therapeutic uses. هنا راح نشوف that beta blockers more effective in young compared to elderly patient. Note that conditions with that discourage the use of beta blockers, for example, severe chronic obstructive lung disease, chronic congestive heart failure, or severe symptomatic occlusive peripheral vascular diseases are more commonly found in elderly and in diabetes. Also, hypertensive patients with concomitant disease اللي عندهم أمراض أخرى مع ارتفاع ضغط الدم. Beta blockers are used treating conditions that may coexist with مثل إيش؟ مثل supraventricular tachyarrhythmia, previous myocardial infarction, angina pectoris, chronic heart failure, chronic انتبهوا chronic heart failure وليس acute heart failure انتبهوا and migraine headache. Pharmacokinetics, they are orally effective. Propranolol undergo extensive and highly variable first pass metabolism. The beta blocker may take several weeks to develop their full effect. طبعا beta blocker ممكن أن تنقسم هي selective non-selective, يعني drugs that block beta 1 and drugs that block beta 1 and beta 2 نسميها non-selective. تصنيف آخر نسميها water soluble and lipid soluble beta blockers. For example, propranolol is lipid soluble one, can be used in the treatment of migraine, but water soluble like atenolol cannot be used, cannot be indicated for migraine because it is water soluble. Adverse effects. Common effects of beta blockers may cause bradycardia and CNS side effects such as fatigue, lethargy, insomnia, and hallucinations. These drugs can also cause hypertension. أكيد يعني ال CNS side effects هي تعود ل lipid soluble beta blockers. Beta blockers may decrease libido and cause impotence. Another side effect is alteration in serum lipid patterns. شنو اللي راح تسوي؟ It will disturb lipid metabolism, decreasing HDL, the good cholesterol, and increasing plasma acylglycerol. Now, drug withdrawal. Abrupt withdrawal may induce angina, myocardial infarction, or even sudden death in patients with ischemic heart disease. Therefore, the dose of these drugs must be tapered over 2 to 3 weeks. In patients with hypertension and ischemic heart disease. Concerning angiotensin converting enzyme inhibitors, linezolid, captopril, the prototype, enalapril, fosinopril, lisinopril, perindopril, ramipril, and another. Angiotensin converting enzyme inhibitors recommended when the preferred first-line agent like diuretics or beta blockers are contraindicated or ineffective actions. The AC inhibitors lower blood pressure by reducing peripheral vascular resistance without increasing cardiac output rate or contractility. These drugs block the AC that cleaves angiotensin 1 to form the potent vasoconstrictor angiotensin 2. It increases bradykinin levels. Vasodilatation occurs as a result of the combined effect of lower vasoconstriction caused by diminished level of angiotensin 2 and the potent vasodilating effect of increased bradykinin.
هنا ماكو صوت شباب، ما مسجل عليه شي، بس مبين هو الميكانيزم مال ال AC inhibitor. اوكي، جاي يحكي عنها انه هنا العملية عندنا هذا الانجيوتنسين. اول شي هذا الانجيو اللي يجيني من الكبد، هنا عندي الانجيوتنسين 1 لازم من راح يتحول الى انجيوتنسين 2، فاحنا راح نغلق هاي العملية التحويل من الانجيوتنسين 1 للانجيوتنسين 2، نقفلها. بالتالي اذا قفلتها راح يقل ذني كلهن، يعني هنا راح يقل، يعني يعكس العملية، بالتالي راح يقلل من البلد بريشر.
Therapeutic uses. Along with the angiotensin receptor blockers, ACE inhibitors slow the progression of diabetic nephropathy and decrease albuminuria. ACE inhibitors are also effective in the management of patients with chronic heart failure. ACE inhibitors are a standard in the care of patients following myocardial infarction. Therapy is started 24 hours after the end of the infarction. Adverse effects. Common side effects include dry cough, rash, fever, altered taste, hypotension in hypovolemic state, and hyperkalemia. The dry cough, which occurs in about 10% of patients, is thought to be due to increased level of bradykinin in the pulmonary tree. Potassium levels must be monitored, and potassium supplements or potassium-sparing diuretics are contraindicated. Another side effect is angioedema, which is a rare but potentially life-threatening reaction and may also be due to increased level of bradykinin. Angiotensin 2 receptor blockers, azlisartan, candesartan, iprosartan, irbesartan, losartan, olmesartan, telmisartan, and the oldest one, valsartan. Angiotensin 2 receptor antagonists are alternatives to the AC inhibitors. This drug blocks the angiotensin 1 receptors. Losartan is the prototype. Currently, there are 6 additional agents. Their pharmacologic effects are similar to those of AC inhibitors, in that they produce arterial and venous dilatation and block aldosterone secretion, thus lowering blood pressure and decreasing salt and water retention. Angiotensin receptor blockers do not increase bradykinin level. They decrease the nephrotoxicity of diabetes, making them an attractive therapy in hypertensive diabetics. Their adverse effects are similar to those of AC inhibitors, although the risk of cough and angioedema are significantly decreased. They are also phytotoxic. Renin inhibitors. A selective renin inhibitor, allosterine, has been released for the treatment of hypertension. Allosterine directly inhibits renin and thus acts earlier in the renin-angiotensin-aldosterone system than AC inhibitors or angiotensin receptor blockers. It lowers blood pressure about as effectively as angiotensin receptor blockers, AC inhibitors, and thiazide. It can also be combined with other antihypertensives such as diuretics, AC inhibitors, angiotensin receptor blockers, or calcium channel blockers. Allosterine can cause diarrhea, which is the distinguished side effect, especially at the higher doses.
هنا هم ماكو صوت بس مبينات هاي أدوية الكالسيوم شانل بلوكر.
Now, another important group is called calcium channel blockers. They are recommended when the preferred first-line agents are contraindicated or ineffective. They are effective in treating hypertension in patients with angina or diabetes. High doses of short-acting calcium channel blockers should be avoided because of increased risk of myocardial infarction due to excessive vasodilatation and marked reflex cardiac stimulation. Classes of calcium channel blockers. We have 3 major classes: diphenylalkylamines like verapamil, which is the least selective of any calcium channel blockers and has significant effect on both cardiac and vascular smooth muscle cells. It is used to treat angina, supraventricular tachyarrhythmias, and migraine headache. The second group is benzodiazepines like diltiazem, affects both cardiac and vascular smooth muscle cells. The third group, called dihydropyridines, this rapidly expanding class of calcium channel blockers includes the first generation nifedipine and 5 second generation agents for treating cardiovascular disease: amlodipine, felodipine, isradipine, nicardipine, and nisloidipine. The second generation calcium channel blockers differ in pharmacokinetic, approved uses, and drug interactions. All dihydropyridines have a much greater affinity for vascular calcium channels than for calcium channels in the heart. They are therefore particularly attractive in treating hypertension. Some of the newer agents, such as amlodipine and nicardipine, have the advantage that they show little interaction with other cardiovascular drugs, such as digoxin or warfarin, which are often used concomitantly with calcium channel blockers. This figure shows the profile of action and side effect of the more distinguished 3 calcium channel blockers. First, dilatation of coronaries. We can see that nifedipine is the strong action, while verapamil is the lowest action. In case of atrioventricular conduction, you can see that nifedipine has a little effect, but verapamil has a more negative effect on AV conduction, more than diltiazem. In case of the frequency of adverse effect, you can see that nifedipine has a frequent adverse effect, comparing to verapamil and diltiazem. Calcium channel blockers have an intrinsic natriuretic effect and therefore do not usually require the addition of a diuretic. These agents are useful in the treatment of hypertensive patients who also have asthma, diabetes, angina, and or peripheral vascular resistance. Most of these agents have short half-lives, about 3 to 8 hours, following an oral dose. Treatment is required 3 times a day to maintain good control of hypertension. Sustained release preparations are available and permit less frequent dosing. Amlodipine has a very long half-life and does not require sustained release formulation. Concerning the adverse effect of calcium channel blockers, constipation occurs in about 10% of patients treated with verapamil. Dizziness, headache, and feeling of fatigue caused by a decrease in blood pressure are more frequent with dihydropyridines. Verapamil should be avoided in patients with congestive heart failure or with atrioventricular block due to its negative inotropic. This means force of cardiac muscle contraction will be decreased, and dromotropic, which is the velocity of conduction. Now, another agents called alpha adrenoceptor blocking agents, prazosine and doxazosine. These are alpha-1 adrenoceptor blockers, as you know that alpha-1 located in the blood vessels. And blocking of these receptors will prevent the binding of catecholamines nor epinephrine from binding to these receptors and leading to inhibition of vasoconstriction. Long-term tachycardia does not occur, but salt and water retention occur with these agents. Postural hypotension may occur in some individuals. Prazosine used to treat mild to moderate hypertension and is prescribed in combination with the propranolol or diuretics for additive effects. Reflex tachycardia and first dose syncope are almost universal adverse effect. First dose syncope معناته يصير إغماء من الجرعة الأولى، ولذلك الجرعة الأولى يفضل أن يأخذها وهو على السرير أو يأخذها في المستشفى مثلا أو في المركز الصحي في عيادة الطبيب، حتى إذا صارت عنده هاي الإغماء يكون يتعالج. أو إحنا نوصي نقول له بالسرير أخذها هذه الجرعة الأولى حتى يتجنب الأشياء المضاعفات الأخرى. Centrally acting adrenergic drugs. Clonidine is alpha-2 agonist, diminish central adrenergic outflow. It is used primarily for the treatment of hypertension that has not responded adequately to treatment with 2 or more drugs. يعني إذا resistant cases راح نستعمل الكلونيدين. It is absorbed well after oral administration and is excreted in kidney. Because it may cause sodium and water retention, it may be administered in combination with diuretic. Adverse effects are generally mild, but the drug can produce sedation and drying of the nasal mucosa. Rebound hypertension occurs following abrupt withdrawal of the drug. إذا قطعناه بصورة مفاجئة راح نشوف صعود الضغط ارتفاع الضغط مرة أخرى. Methyl dopa is also alpha-2 agonist as converted to methyl norepinephrine. It is also called false transmitter لأنه احنا عندنا الترانسميتر هو دوبا اللي تتحول إلى دوبامين بعدين إلى نورابينفرين، ولكن هنا عندنا مثل دوبا راح يتحول إلى مثل دوبامين مثل نورابينفرين. مثل norepinephrine is false transmitter. There is no binding with the alpha receptors. So this leads to reduced total peripheral resistance and decrease the blood pressure. The most common side effect of methyl dopa are sedation and drowsiness. It has used in the hypertensive pregnant patient. Now, vasodilators. Direct acting muscle relaxants with muscle relaxants such as hydralazine and minoxidil have traditionally not been used as primary drug to treat hypertension. Vasodilators act by producing relaxation of this vascular smooth muscle, which decreases resistance and therefore blood pressure. These agents produce reflex stimulation of the heart, resulting in the competing reflexes of increased myocardial contractility, heart rate, and oxygen consumption. These actions may prompt angina pectoris, myocardial infarction, or cardiac failure in indisposed individual. يعني البيشنت اللي يكون مستعد للإصابة بالذبحة الصدرية لما نعطيه هذا الأدوية اللي راح تسوي ريفلكس تاكيكارديا، يعني الهارت ريت انكريز، يعني معناته الورك لود راح انكريز تو ذا هارت، ومعناته الاكسجين كونسامبشن يزيد، وهي هاي المشكلة بالانجين. منو عندنا agents hydralazine cause direct vasodilatation acting primarily on the arteries and arterioles. This results in decreased peripheral resistance, which in turn prompts a reflex elevation in heart rate and cardiac output. It is used to treat moderately severe hypertension. It's almost always administered in combination with beta blockers, such as propranolol, ليش؟ To balance the reflex tachycardia. And diuretics. Diuretics ليش؟ دائما وياه to decrease sodium retention. Minoxidil is another vasodilator, causes dilatation of resistance vessels اللي هي arterioles, but not of capacitance vessels اللي هم venules. It is administered orally for treatment of severe to malignant hypertension that is refractory to other drugs. Reflex tachycardia and fluid retention may be severe and require the concomitant use of loop diuretics and beta blockers. Minoxidil causes serious sodium and water retention, leading to volume overload, edema, and congestive heart failure. Now, hypertension emergency. It is a rare but life-threatening situation in which the diastolic blood pressure either more than 150 millimeter mercury with systolic blood pressure more than 210 millimeter mercury in an otherwise healthy person, or more than 130 millimeter mercury in the individual with pre-existing complications such as encephalopathy, cerebral hemorrhage, left ventricular failure, or aortic stenosis. The therapeutic goal is to rapidly reduce blood pressure. Sodium nitroprusside is administered intravenously and causes prompt vasodilatation with reflex tachycardia. It is capable of reducing blood pressure in all patients, regardless of the cause of hypertension. Whatever the cause, هو صوديوم نيتروبروسايد راح يخلي ضغط الدم، ولذلك هو يستعمل لعلاج hypertensive emergency. The drug has little effect outside the vascular system. Because nitroprusside also acts on the veins, it can cause reduced cardiac preload. It is metabolized rapidly, and its half-life of minutes require continuous infusion to maintain its hypertensive action. It exerts a few adverse effects except for those of another agent used for the treatment of hypertensive emergency is phenol-dopam. Is a peripheral dopamine 1 receptor agonist that is given as an intravenous infusion. Unlike other parenteral antihypertensive agents, phenol-dopam maintain or increase renal perfusion while it lowers blood pressure. يعني صحيح هو راح يقلل البلد بريشر، ولكن أيضا يزيد الرينال perfusion، وهذه ميزة جيدة لهذا الدواء. Phenol-dopam can be safely used in all hypertensive emergencies and may be particularly beneficial in patients with renal insufficiency. Nicardipine, a calcium channel blockers, can also be given intravenous infusion for the treatment of hypertensive emergency. Resistant hypertension is defined as blood pressure that remains elevated above the goal despite administration of an optimal 3-drug regimen that include diuretics. شنو السبب؟ يعني هو البيشنت ياخذ الدواء ومحتمل ياخذ 3 أدوية ولكن يبقى الضغط. Resistant hypertension is defined as blood pressure that remains elevated above the goal despite administration of an optimal 3-drug regimen that include diuretics. شنو السبب؟ يعني هو البيشنت ياخذ الدواء ومحتمل ياخذ 3 أدوية ولكن يبقى الضغط مرتفع. شنو السبب؟ Most common causes of resistant hypertension are poor compliance. ما يستمر على الدواء بصورة منتظمة. Excessive ethanol intake. Concomitant conditions like diabetes, obesity, sleep apnea, hyperaldosteronism, high salt intake, and or metabolic syndrome. يجوز عدة واحد من هذين الأمراض أيضا يسببن هذا resistant hypertension. Concomitant medications مثلا هو يأخذ sympathomimetics, non-steroidal anti-inflammatory drugs يأخذ, or corticosteroids يأخذ يجوز واحد من هذين الأدوية وبالتالي يصير عنده resistant hypertension. سبب آخر هو insufficient dose and or drugs and use of drugs with similar mechanism of action.